On a normal evening, before social distancing was a thing, a class at the YogaStand would have held a dozen or so students. But once the coronavirus hit Lubbock, attendance dwindled to a single student. So when classes were eventually canceled, the decision was made to move to virtual sessions.
I'm kind of being forced into starting an online business, which I'm fortunate. A lot of businesses can't even do that. It's almost like I'm launching another business within a business when I don't have the time, resources, and wasn't even ready for it.
That's Haley Bevers, the owner of the YogaStand. She explains that most of the yoga studios she knows about are scrambling to get recordings out to their students, not only to save membership, but also to provide their students with some much-needed yoga during this period of isolation.
Helping people get their mind right is really the tough part because there's legitimate, true fear going on.
We've been hearing the phrase flattening the curve now for weeks. If you don't know what that means, Catherine Wells, the director of public health here in Lubbock, gives us a quick rundown.
The thing is if we get a lot of people exposed very quickly, we're going to end up with a huge increase in disease all at the same time. If we can slow that disease spread so that we don't end up with too many people sick at one time, we won't overburden our healthcare system.
And while this period of isolation is probably frustrating to many, especially small businesses, the good news is that if we stick to it, Lubbock is in pretty decent shape to handle this. Dr. Craig Ryan, the Chief Medical Officer of Covenant Health System, gave an overview of what their capacity looks like.
We have about 80 total ventilators in the Covenant Health System, and we have 60 plus anesthesia machines, and the total number of ICU beds we have is 137 ICU beds at Covenant. So we have lots of capacity. We can be flexible. I would say that we probably are in really good shape. The majority of hospitals don't have anywhere near that kind of reserve.
Wells and others we've talked to agree that the city has handled the situation pretty well. But now a lot of it is in the community's hands, and that's where Wells' biggest concern comes in.
It's really getting people to really take this seriously. I kind of see it as this is kind of the beginning of it, but we really want to work on containment and reduce the risk of contracting this disease to as many people as possible, because we don't want to get to a point where we would overwhelm our healthcare system. And that's both for Lubbock, and then that's for all of these surrounding communities that also feed into UMC and Covenant.
Stay up to date with our COVID coverage at kttz.org. For Texas Tech Public Media, I'm Casey Ellingson. COVID-19 coverage is brought to you in part by Texas Mutual Insurance Company, a health and safety-focused workers' compensation provider.